Evening, everybody. Welcome to our Share and Learn on supporting people who are newly diagnosed with type 2 diabetes. It's our final Share and Learn of 2025. So thank you very much for joining us. And we're going to start by hearing from two members of Diabetes UK staff, the co-leads for the strategic ambition around supporting people who are newly diagnosed. So Phaedra and Tina, I shall hand over to you, and I'll let you introduce yourselves and then ask each other the questions you've got so people can learn a little bit more about this ambition. Thank you.
Great. Thanks, Danny. Phaedra, do you want to kick off?
Yeah, thank you very much, Danny. So hi, I'm Phaedra Perry. I'm head of Diabetes UK in South West and South Central and co-lead with Tina of our newly diagnosed with type 2 diabetes ambition. And Tina?
Thanks. And I'm Tina McCross, and I'm the person who said I was from cold Northern Ireland, although there may be a few other people on the call as well. I'm National Director for Northern Ireland, and I'm co-lead for this piece of work, this ambition.
Okay, thank you. So we're going to ask each other just a couple of questions, which will hopefully give you a good feel for what this ambition programme is focused about. So Tina, can I just ask you to start off and talk us through what are Diabetes UK's ambitions as a charity?
Yeah, no problem. Everybody can hear me okay, yeah? Yeah. So when we talk about our ambitions, what we're really talking about is how we organise ourselves, how we describe the work that we do in our really priority areas across the whole organisation. And we're also talking about what we do over the next 3 to 5 years. So it's medium-term planning. The ambitions give us a very clear focus, and this helps us when we're planning. It helps us when we're looking at the difference we're making and how much of a difference we're making. And it also helps us particularly in decisions about how we focus our resources so that we can have the greatest impact. So we have a limited resource in terms of money, in terms of people, and it's really important that we target that as much as possible. And when we talk about the ambitions, we tend to talk about them in 3 groupings. I'll talk you through those now. Some of you will have heard this before if you've been on other Share and Learn sessions, but just to kind of give an overview. So the first area is changing the narrative. And there's 2 ambitions linked in with this. One is about achieving diabetes equity, and the other is about tackling stigma. And we know that people with diabetes can experience poor health outcomes. And our aim is to narrow that gap in diabetes risk and health outcomes for groups of people experiencing the greatest inequity. So it's trying to balance that off. Similarly, we know that stigma is a very real challenge for many people, and that it can result in people not accessing or not being able to receive the care that they need. And again, that can lead to poor health outcomes as well as kind of really heavy personal impacts in terms of confidence and ability to manage their diabetes. So changing how we speak about these 2 things, about inequity and about stigma, it's fundamental to how we move forward with our other ambitions. It kind of underpins everything else. And it's really important that we challenge these barriers where we can. And hopefully some of you will have seen our Stamping Out Stigma campaign, which was launched on World Diabetes Day a couple of weeks ago. So our next set of ambitions fall under the heading of curing or preventing diabetes. And ultimately, what we're all working towards is a world where diabetes can do no harm. And this set of ambitions is very clearly focusing on this big wish that we have. So our aim through Type 1 Cure or Prevent ambition is that through a partnership with Steve Morgan Foundation and Breakthrough T1D to continue to fund the £50 million of research over this period of time to accelerate the breakthroughs in type 1 diabetes treatments and hopefully pave the way to a cure for type 1 diabetes. And the type 2 Grand Challenge aims to bring millions of pounds in new investment, again, to accelerate our understanding of type 2 and gestational diabetes, to develop new and better interventions and to enable millions of people to benefit from better ways that we can prevent diabetes, or that they can manage their diabetes, or that ultimately that we cure these conditions. And then the third ambition within this category is prevention of type 2 diabetes. And with this, we know that the numbers of people being diagnosed with type 2 is just increasing year on year. And our goal here is to stem that rise in type 2 diabetes. And we do this by a number of areas across all the teams, but specifically by advocating for a healthier food environment and also for improved support for people with NDH and following GDM in pregnancy to reduce their risk of developing type 2. And our third category of ambitions, when we talk about them in this way, is supporting people living well with diabetes. There's 3 ambitions linked with this. One is the better essential care, which is making sure that people with diabetes are able to access their care processes, so the important checks that they need to keep well, and also supporting healthcare professionals and the health system to ensure that access is there for people. Supporting newly diagnosed people with type 2 is part of this grouping of ambitions, and that's really what we're going to be talking about in much more detail. And then the third one in this area is type 1 together. So this is our funded project for young people aged 11 to 25 who are diagnosed with type 1 diabetes, and we're halfway through that 5-year program at this stage. And then there are 2 further ambitions which cut across all our work, and they really are there to drive and support our progress. One of those is growing our income, which is all about how we bring money into the organisation, our income generation, our fundraising. And the other is around better data and technology to make sure that we're as effective as we can. So these are collectively what we mean when we talk about our ambitions. They are the primary focus of our activity over the next 3 to 5 years. And then sitting alongside those, we have what we call our foundational work. And that's the things that we need to do to keep ticking over. So it's the work that we do day to day in running the organisation. It's our other areas of work that maybe are funded externally that we need to deliver on. And particularly it's around our what we call the universal offer, so our helpline, our learning zone, online forum, peer support. So just in summary there, the ambitions give us a clear focus and direction, and regardless of what team we're working in, all our work aligns with these ambitions. And I think over the last couple of years, this has become much clearer and much tighter for us, and we're all much more confident about which ambitions our work aligns with and what we're trying to achieve through those ambitions. Brilliant. So that is a very quick run through on what our ambitions are.
Thank you, Tina. I know it's not easy to cover a whole strategy in a matter of minutes, so thank you very much for that.
And hopefully I haven't left out anything completely major, but we have time for questions and answer later. Phaedra, my first question for you then is, I'd mentioned that one of our ambitions is around newly diagnosed support for people with type 2 diabetes. Can you tell us why this is one of our ambitions?
Yeah, absolutely. So every year, about 250,000 people are diagnosed with type 2 diabetes, and we know that this number is set to rise. We often hear from people living with type 2 that the support they get at diagnosis is pretty poor and it needs improving. We know that people have complex needs right from the start that can be psychological or practical, and that these needs aren't being met. Disappointingly, we know that many people are not informed about the possibility of trying to put their diabetes into remission, let alone supported to try. We also know from people living with type 2 diabetes that for most, the diagnosis comes as a huge shock. For a small minority, they might be relieved to finally receive a diagnosis, having known that something wasn't quite right. But people report feeling lost, overwhelmed, shameful, scared, anxious, and isolated, with younger adults in particular feeling emotional around their diabetes compared to older adults. So we know that when people access our information and support at Diabetes UK, that they hugely value it. But we also know that we are not reaching and supporting as many of these people as we want to at that critical point of when they get that diagnosis. So within this ambition, our drive is really to support more people with type 2 diabetes within their first year of diagnosis, trying to reach at least half of them. This is so that they get that support and high quality advice and can start taking action, for example, trying for remission, sooner rather than later, knowing that this can improve outcomes for them both physically and mentally. To do this, we know we need to reach at scale. That's a huge number of people that we want to get to at that point that they get that diagnosis. And we know that what we need is a consistent offer that goes directly into people's hands at that point of diagnosis. So we become that trusted source of information and support, and people aren't left dealing with a diagnosis alone until they may happen to stumble across us. Our goal really with this ambition is that with our ongoing support, people understand more about their type 2 diabetes, what they need to do to look after themselves, the care they should expect, their remission options, how Diabetes UK and others can support them. We want to make sure that people feel understood, empowered, motivated by our support, and reduce any of those feelings of self-stigma. So that's how this ambition has come about.
Thanks. Thanks for that, Phaedra. That's a really good summary of why this, because I know it's a question that we get asked quite a bit. Well, why are you focusing on this particular area? So thanks for helping with that.
Okay. So what would be helpful, Tina, if you could just talk to us a little bit about what we've been doing as a charity over the past 12 months under this ambition, and then what we've got in plan over the next 12 months as well for the newly diagnosed with type 2 area.
Yeah, sure. So I'm going to just pull out a few of the things that you referred to, Phaedra, because that really hones down on what we've been focusing on. So you were saying that this ambition is about reaching at least half of the people who are newly diagnosed with type 2 every year, that it is about reaching people, and that's reaching at scale. It's about making a practical difference for people very early on, as close to their point of diagnosis as possible, so that they have information and that they have choices. So this time last year, when we were doing our planning for 2025, we were very clearly thinking about, well, if you're going to try and reach half of everybody that's diagnosed, that's a huge number. And we're really only going to do that if we have a systemic opportunity, an opportunity through the health system or something really, really big. But that no matter how much money we have as Diabetes UK, no matter how many staff or volunteers, we're never going to reach that big number ourselves. So we had one eye on that big opportunity. But we also knew that was, it wasn't predictable. It wasn't something we could rely on. And we ourselves there was only so much we could do to make that happen. So at the same time, we were planning, well, if we can't do this, what are the other things we can do at scale to try and reach as many people as possible? So I would say for the early part of this year, within this ambition, we had one eye on the big opportunity, but we were very much planning and focusing on plans B, C, and D. And to be honest with you, I don't think we could have predicted this time last year where we would be now. And that centres around, I suppose, the announcement from Number 10 in July about Diagnosis Connect, which I'll speak about in a bit more detail in a minute. But Diagnosis Connect is an opportunity that will come through NHS England for a number of charities to potentially work together to create a hub where people who are newly diagnosed with these conditions in primary care get signposted into the right charity at that point of diagnosis. So that really is the big thing that we would have been hoping for. So I think since that announcement came out in July, we've very much been focused on, right, if this is going to be a reality, what do we need to do as an organisation to make the most of this, to make every effort that we are one of the conditions, one of the charities that we're focusing on, and that we can be as ready as possible. So in our work plan for 2025, the work has been very much about being clear about what our offer is. What is it that we can offer to people who are newly diagnosed with type 2? And then what are the ways that people can tap into that journey or be signposted into that journey? So where we are at this stage is I suppose it's fair to say this is kind of probably the single biggest thing that everybody in the organisation, or as many people in the organisation as possible, are working on making a reality at the minute. And there's a really big push on that by the middle of December, we have completely clarified what our offer is. We're very clear on the journey. We understand what the opportunity is to bid for money to be part of this opportunity, and that we have something that we can test. And that's where we are. By the time we finish for the Christmas holiday, we will have all of those things in place, and we'll be ready to finish one pilot and start a new pilot on a very specific aspect of this as soon as we come back after the Christmas holidays. So the opportunity that's come around is called Diagnosis Connect, and what it means is that people with specific diagnoses, of which we're reasonably confident that diabetes will be one, which is why we are putting up so much energy into it, that they will be signposted to us as Diabetes UK, and our work is to make sure that when they are signposted to us, they get the information and the reassurance that they need, that they have a range of questions answered, and that there is a journey mapped out for them. But that journey will be different for different people. We've mapped out the whole journey, but people, as you know, will need different things at different times. So that's the work we're doing at the minute. The other part of your question was, what about the next 12 months? So the next 12 months really is to complete the 2 pilots, to learn as much as we can from what we're testing of the journey and the offer, that we are absolutely ready as an organisation to put ourselves forward for Diagnosis Connect, so that we make the most of this opportunity to reach at least half of the people who are newly diagnosed with type 2, because we believe that's what's really going to make a difference. At the same time, we'll still have an eye on other things that we can do if for any reason this doesn't materialize the way that we expect it to. And we're also within the 3 nations, because this is NHS England, so it's England only. So within the nations, Scotland, Wales, and Northern Ireland, we're looking at what the opportunities are there for something similar at system level, or something that will allow us to offer the same thing and reach people at scale. So there's work throughout 2026 that's very much testing the model we've developed, being ready to put in a bid for it, being ready to hit the ground running and do the best job possible, but also have a plan B, plan C in our minds, and look at how we can replicate this to reach people at scale in the nations.
Thank you, Tina. And I think it really shows just how much influence Diabetes UK has been having in terms of the health system and the government, to really show that we are a trusted organisation and that we have really valuable resources and support we can offer people. And this is, I think, one of the most exciting opportunities that we've faced as an organisation. So thank you for that.
Yeah, I think that's right. And Phaedra, I certainly think that when we were sitting here this time last year, we just couldn't have anticipated we would be here. We hoped, but I don't think we could have. So, I mean, this is a real game changer, and it's a very exciting time for us. So my last question for you, Phaedra, is what opportunities are there for volunteers to support people who are newly diagnosed?
Thank you. So you all as volunteers, you play such a huge part in our support offering to people with or at risk of diabetes. You also play a really important role in raising awareness of Diabetes UK, and the support people can gain from us. Your reach into your local communities it's just so important for ensuring that those who need us the most can benefit from all that we have to offer. So many of you will either have diabetes yourself or have a close connection to someone who has. This means you have your own lived experience of what it's like to receive a diagnosis, what those first 12 months were like, or to see a loved one go through that themselves. You may have experienced yourselves many of the emotions we know people are saying they experience. You may have felt lost or overwhelmed or scared or anxious or isolated. And as volunteers for Diabetes UK, it's likely that at some point you sought support from us, or perhaps you saw a post, or perhaps you heard about a local group, and that you benefited from it enough to want to give back by volunteering your time and energy to help us. So with that background, I think what we have in all of you is just an absolute powerhouse of knowledge, experience, and empathy, really important empathy, all basically waiting to give out a supportive hand or ear to others when they go through that journey themselves of diagnosis and learning to live well with diabetes. So to give just some examples of how, as volunteers, you could really support this ambition. That would be really for us about channeling that experience and the empathy and knowledge that you have of diabetes and Diabetes UK and the support, and channeling that and taking that out into your own communities. This could be through getting in touch with providers of a local admission service and offering to give a talk at one of their information evenings, or as part of their course, talking about what your experiences were, helping people to relate and know that other people have gone through that and what has helped you. You could offer up such a talk at your local GP surgery or a community centre, a place of worship, really sort of talking about your own experiences, what helped you and what support is available to them. If you are still at work, you can go to your HR or their wellbeing team and ask, could you give such a talk during Diabetes Week? Or you could explore perhaps becoming a workplace ambassador for Diabetes UK. So there's lots of different opportunities where you may feel able to go out and talk about your experiences and about Diabetes UK. And if you've not had speaker training from us before, then please get in touch with your local team and you can find out when those training dates are and how we can support you with that. Now, if public speaking to large crowds or even small crowds is really not your thing, then other ways you can help us might be in holding an information stand with Diabetes UK resources, which you feel are most helpful to those when they're newly diagnosed with type 2 diabetes, such as the Guide to Type 2 Diabetes, the Eating Well, the Food Labels Made Easy. You'll have a good idea about what you feel will work best for people. To do this, you could try contacting your Tesco community champion to have a stand during Diabetes Week or World Diabetes Day or any time of the year. You could go to local sporting venues if that's what you like doing, such as football stadiums. Basically places where you know you're going to have a high footfall of people who would really value that opportunity just to get a little bit more information from you about someone who's already gone through that or someone who really understands what they're going through. If you're running or connected to a Diabetes UK local or community group, you could look at how you could support that group in promoting it within those local communities. So that might be on sort of local community Facebook pages, for example, a really good way to share this. You could look at holding open evenings specifically for newly diagnosed to come and just ask any questions that they might have, get more information and support. You can promote these through all the different community spaces that you tend to go to and where others will find that information too. We're also relaunching our new Diabetes Voices Network, which is a great chance to get more closely involved with a lot of work at Diabetes UK. And then as we continue to develop the supporter journey and Diagnosis Connect, we know we're going to need volunteers to help us review our offer and talk about their experiences and help us to continue shaping and evolving this offer as we go forward. Because this is a long-term ambition for us. We're going to see lots of new things come through, and actually having your help and support in that way will be hugely helpful too. And I'm going to end it there, slightly over time, apologies.
Thank you so much, Phaedra and Tina. Slightly over time, but with lots of such interesting information, hopefully giving lots of inspirational ideas to volunteers. And speaking of which, I'm really pleased now to be handing over to two volunteers. So we're going to start with Mike, who, although it might not seem like it, Mike is wearing two hats right now, in that he used to be a Diabetes UK volunteer and loved it so much, he is now a Diabetes UK member of staff on our forum. So I won't give any more spoilers, but Mike, I shall hand over to you, ask you to introduce yourself and tell us about your volunteering on the forum to support people who are newly diagnosed.
Hi there, my name's Mike. I've been living with type 1 diabetes for almost 35 years, and I first joined the Diabetes UK forum I hate to think it's probably 20 years ago or something like that. It's a long time, 15, 20 years ago. And the forum, for those of you who haven't come across it, it's a text-based message board where it's very well moderated. It's a safe space where you can go and you can ask any question. You can just share your experiences. You can rant about the nonsense that diabetes throws at you day to day. And you can just get really practical tips on living with diabetes. And one of the good things about it for me as an individual was that it was quite different. I've found hearing a piece of advice from a healthcare professional and asking a question on a diabetes forum, and because when you hear it from a doctor, it's like, oh, what do you know? You don't live with this day to day, blah, 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 blah. It's really hard. But then when you're getting responses from people who've been living with the same condition as you and face the same challenges, for perhaps a lot longer than you, or someone who's joined the diabetes train later on and has had some new information that you haven't been updated on because it was just assumed by your clinic that you probably had picked that up already. It was very different hearing it from people who are walking the walk, and rather than just people who you kind of got the feeling did it with book learning. So on a personal level, it was a great encouragement to me, and that led me to sort of stick around. After a little while, I was asked by the then admin whether I fancied considering being a role as a volunteer moderator. One of the things about an online message board like the forum is, for a start, you've got to keep all the nonsense out, all the sort of people trying to palm off herbal cures and just posting random spam links. So there's that sort of thing. And there's also people just occasionally, because it's text-based and you haven't got, you're not seeing people face-to-face, you don't get tone of voice, you don't got body language. Sometimes there's a bit of miscommunication, or people get the wrong end of the stick, or they just get, they get grumpy with each other. Because when people are on the forum, quite often they are emotionally heightened state. They might have only just been diagnosed. They might be really struggling, or have been really struggling for a long time. So having a team of volunteers who have various experiences, some people with type 1, some people with type 2, some people with type 3C, people who've been pregnant with diabetes, people who are parents of children with diabetes, having a team of people to help steer the conversations, and also having a team of what we call forum hosts, who just make sure that everyone gets a really nice warm welcome. The forum is a very warm and welcoming and friendly community. But it's busy and quite fast paced at times. So it's good to have some people looking out and just making sure that that everyone's getting an answer. Everyone's getting, and as soon as threads, because the messages are stored in sort of like vertical conversations, really. As soon as a few replies are happening, then the conversation unfolds. In terms of how the forum helps people who are newly diagnosed, it really goes back to what Phaedra was saying about some people get very little information. Some people just get a text message and then that's it. Some people get, here's a prescription, go and get these metformin and I'll see you in 6 months. And they just go, what? What do you mean? And they've got nothing to go on. They've got literally no information. So to have a bunch of people, some of whom will have been living with the condition for decades, some of whom would have been diagnosed last week, kind of going, oh, do you know, I know exactly what you're feeling. I was like that last week. It was really friendly here. They give me I found this link that someone shared with me really handy. You might want to have a look at that. It's a very sort of natural, encouraging, nurturing environment. And it allows people to just ask all the stupid questions that maybe they're a bit embarrassed to ask their actual doctor. Because you're just among friends, you're among peers, and you can just say anything and ask anything. And because the forum has such a large and varied group of people, there's not many things that we haven't had experience of, and because a lot of the people on the forum really quite value it in terms of their own diabetes management, they hang around, and and so they'll know. Somebody else. Who is it? The blah, blah username. They've got that rare foot thing that you've just mentioned, that you've been, you've joined the forum because you're really upset because you've been for your annual review and you've just been told you've got this, you're developing this problem with your feet or whatever, and it's not one you've ever heard of, and what on earth does it mean? Oh, well, that's all right, because we've got somebody who dealt with that last year, and they can give you pointers on what happened with them. So that's the sort of thing, really, that the forum is good at, and it's good at doing it for people who have literally just been diagnosed. It's also good for people who've been diagnosed for ages, but they've just sort of missed a chunk of information. But we get, I don't know, 10 or 15 people probably every week joining. And some of them join saying, I've just been diagnosed with type 2, and it doesn't, I'm really struggling. I'm doing everything I'm told, but it's really, and the forum's got quite a good nose for, like, oh, hang on, did you have this experience? Was it like that? How rapidly did this come on? So sometimes it can give people who are newly diagnosed some quite good questions to ask their healthcare professionals, just in case an assumption was made about their type of diabetes, and they might need a bit more looking into. It might be a bit more niche, one of the rarer ones. So the forum could not survive without its volunteer hosts and volunteer moderators, because it's kind of 24/7, and we've got bless him, we've got one mod who's sort of partially insomniac, so he's on all hours. He not so much during the day, but so we've got coverage pretty much 24 hours a day, and we couldn't run it without our brilliant volunteers. And it's also really nice because, in a sense, everyone on the forum becomes a part of the community, and they start supporting each other. So it's not top down, it's very much level playing field. Everyone is kind of, I didn't set a timer. Sorry, have I gone over my time? Is that enough? Shall I stop now?
That was wonderful, Mike. Well, I think you've got to a great point. Is there anything you wanted to say to finish? I mean, I'm inspired. That was wonderful.
Join it. Come and join the forum. It's great. And hardly anyone gets grumpy with each other at all, ever. Honest.
Thank you, Mike. Well, if that's not a call to action, then I don't know what is. Thank you so much, Mike. And I think, like you said, it wouldn't exist if it wasn't for volunteers. So that's really inspirational. Thank you. And the next volunteer we're going to hear from is Peter. So, Peter, I will invite you to come off mute. Let me know if you're waving at us. I will ask you to unmute. There we go. We can hear you. We can see you. So Peter is joining us from the Northwest and has a very different volunteer role, in that he is the founder of the Southport and Ormskirk group. And we've also got Linda here as well. I can see you, Linda, who is on the group as well and supports with the group. But Peter, I'm going to start by asking you to introduce yourself and tell us a little bit about your volunteer role.
Yes, Peter Lloyd. I became involved with Diabetes UK thanks to the lovely Vanessa Labour. I eventually found her through the minefield of trying to find the right person online. I was all over the country, ridiculous really, but eventually Vanessa and is it Linda? Anyway, we had great help from Vanessa. I dropped out at one time because I couldn't cope with all the H&S stuff, and oh God, it just went on and on. Anyway, Vanessa got me through. Now, the support group that I got involved in is down to support group that I was already in with prostate cancer. And I thought, this is a wonderful organisation to help other people, help each other. We're all in this boat together. We need to try and share our feelings, our emotions, our stories, etc. So I thought, this is a wonderful opportunity. The same room in the same pub, which is a community pub in Southport called the Richmond. And I spoke to Michelle, the manager, and I said, do you think I could have a room, it's the same room, on a Monday night? And she said, Peter, just go ahead. No charge at all. So I decided I'm going to do this because my my son, the younger son, had a terrible time with atrophy in his legs. He didn't even know he had diabetes. With all the driving he was doing to Manchester, the pains in his legs, he thought was driving. Well, it wasn't. He had 2 years of misery with not knowing what it was. So he came to talk about his experiences in the prostate cancer. Stop it, Peter. The diabetes meeting. And we learned so much just from him. Sorry, a bit of man flu. Anyway, the group started with 6 of us in the same room that we used for prostate cancer. Total strangers. Nobody knew each other. Just 6 of us, and we had no speaker, and we had no papers, and we had nothing to look at other than we spoke to each other. We interacted. We got together. We had a lovely little discussion. It started it, and it's blossomed since then. And I've got so much support from Linda, who worked for the NHS for a long time. And I had so much help from her. I only wanted to do the admin, but moving very swiftly forward, we had Dr. Unwin with us, who believes in this low-carb diet. And it's a wonderful diet. It's very strict, but he's took out about 100 people and more out of type 2 to be diabetes free. And he's been at our meeting once, and he's at our meeting again. He's nationally famous, this man, this doctor, and his wife is as well, Dr. Unwin, and I'm so lucky to have him in Southport. So we've had the benefits of his knowledge and his experience. He's nationally famous. He's been on the front pages of the papers. We're very lucky to have him in our area. So moving on again, I live in Ormskirk, 7 miles away from Southport. Now, we couldn't get the folk from Ormskirk to come along, but I've learned so much in 6 months. Knowledge is everything, and I decided I'll try and do one in Ormskirk. So we had a little pop-up meeting in our community hub, and we got 4 people straight away. And now we've got another room in a sister pub to the Richmond. So we're going to have another meeting and invite a few more people. The support group has been outstanding. Everybody talks, everybody gives their story. As much as Mike's forum must be great, because I've not even been in it. So perhaps I should have done, but I've gained all my knowledge through the support group. I am very lucky to have such wonderful people around me, because I certainly need help. The whole thing is all about supporting each other, talk to each other. We've had good speakers in, very good speakers. It's not easy to get a speaker, but we have managed. A friend of mine in the hospital where I was a volunteer, and I'm not now, but and also we've got our diabetes clinician coming to the February B. So it is hard to get good speakers, but as I say, we're lucky to have Dr. Unwin. I think support group. What Mike was saying. Go into it wasn't Mike. Go into various places, workplaces. Yeah, the pubs can do it, you know. Pubs, a lot of people in pubs who have type 2. It can be anywhere, the church, the supermarket. Even the supermarket wouldn't say no. Get a little pop-up session going and see how many people turn up. And if you've got enough knowledge, I've gained enough knowledge now to talk about it, and I'm enjoying it. And as I say, I'm going to have my own meeting completely on my own on the 16th of December, and then again in February. So the support group has given me the knowledge, given me the experience and the confidence to do it. And I was type 2, I was drifted into diabetes with the numbers 56 or something like that. I came down, and eventually now I've dropped down again. So I'm now pre-diabetic, and I've had 2 latest tests, and I'm still under 48. By just cutting out all the sugary stuff, it wasn't a massive diet. It wasn't a low-carb diet, but some people have to have it. I was lucky, I cut out all the sweets, chocolates, cakes. Well, it was very painful, to be honest. So I have the sugar-free chocolate and Lucozade and jam even. There's so many things you can cut out to make your diabetes better. So it can be done. Thank you.
Thank you. And yeah, it's really inspirational for you to talk about the peer support that you can get from the group. And yeah, brilliant. You've got some speakers. Andy's just popped in the chat there that I'm just recognizing we do know low carb isn't the best, most hopeful way forward for people. So it's a portion to speak to a healthcare professional. But yeah, really, really pleased to hear it's working for you, Peter, and you're doing so well. Thank you very much.
Yeah, thank you.
Thank you very much. Yeah, thank you to you, Peter, and to Mike. We'll stop the recording there.